Shropshire, Telford and Wrekin. For those of you who don't know, I'm Green. I'm the recently appointed chair of the ICB. So at the start of this, I'm very grateful for everybody who I'm meeting with. And it's also welcome to my appointment on the. This is a meeting held in public, it's the annual general meeting. There is an opportunity for a couple of questions at the end. And we will be going through the agenda shortly. We have some apologies for absence from members from David Bennett, John Carr, and Nitty Paul, and then from the participants, Harry Turner, Helen Onions, Heather Keith, Felicity Mercer, and Pauline Gibson. In order for there to be a quorum, with two board members present, I can confirm there are two board members present at the meeting. This is a bit about me for those who'd like to know a bit about me. I live just across the border in Howells. My background is in leading national charity and executive roles. I was chief executive of the YMCA in Wales. Also, most recently, chief executive of Telford and Wrekin, the HIV and sexual health charity. I've had non-executive roles in the NHS before, chair of Ealing Hospital, when it was a standalone trust. Most recently, chair of Salisbury NHS Foundation Trust, and also chair of the NHS Commission Committee in Wales, specialist. So delighted to be appointed as the chair of the ICB. And as people may be aware, that we'll touch this on the board meeting later, that we are now entering into a customer arrangement, a relationship with our colleagues in Staffordshire, especially friends. I've been appointed as chair of that ICB as well, as part of the custody arrangements. So, the purpose of the day is to reflect upon the last year of the Shropshire and look at the annual report as annual annual accounts, but really importantly to look forward to the year ahead and our current priorities. I mentioned the quorum, we are quorum, and we do need to approve the minutes of the last meeting. For members of the public who are online, there is a link to that. And I just want to check if we're happy to approve the minutes of the previous meeting. Agreed? Yes, thank you very much then. They are agreed. So in terms of the format for the meeting, it is being recorded and it will be available on our website. If people can keep their microphones, particularly if they're Teams call, and as I mentioned, there will be an opportunity to ask questions. We have time for a couple of questions. If we're not able to answer any of these questions live, we will ensure that they are captured and we'll answer those questions after. We don't have any pre-submitted questions, but there may be questions we can. So that's the format for this meeting. A bit up there in terms of the slide about our purpose. We were created on the 1st of July in 2022 with a responsibility for planning and buying a wide range of health and care services for the whole of Shropshire, Telford and Wrekin as part of an integrated system. You'll see there the focus of our main areas of focus of the integrated care system, and what we're here to deliver on behalf of our population. And the next slide, lots of people in the room know about our population. We're one of the smallest, I think the smallest, ICB in the country, serving a population of just over 500,000. Whilst there's a focus around the two main towns of Shrewsbury and Telford, we serve a significantly rural community, and that brings with it opportunities but also challenges. And I think it's really important we remind ourselves of that and the importance of making sure that we are thinking in terms of population health, but also tackling the health inequalities that exist because of the difference within our population, perhaps, to other integrated care systems. And so that's our population. And in terms of who we are as a system, as I mentioned, we are the commissioning organisation within the integrated care system, the integrated care board, and our colleagues and providers and members of the system include acute community specialist trust, the mental health trust, the ambulance trust, a range of GP practices, 50 GP practices, community pharmacies, dental practices, optometrists, and really importantly, our partner local authorities in Shropshire and Telford and Wrekin councils. And in terms of the board, this is us. Many of the board members are in the room today and some online. And our role, both as executive, non-executive, and appointed members from providers and partners, is to ensure that the decisions taken by the Integrated Care Board to commission resources for the system are used properly and using best governance. So that's all I wanted to say in introduction. I'm now going to hand over to Simon, who's going to lead us through reflection.
Thank you, Chair. So, firstly, welcome. Great to have you. It must be one of the quickest roles where you applied for one ICB and got two for the price of one. But great to have you, and really looking forward to working with you as we work through in terms of developing the cluster and move forward from there. Recognising AGM is always one of those bits where we look back, so at times it feels a little bit clunky because we're talking about what's taking place in 24-25, as we're already a big chunk of the way through 25-26. However, on those reflections in terms of looking back, I think it's really important to recognise that 24-25 across many areas continued to be a challenging year, but demonstrated progress in a number of areas as well. And certainly, whilst we made progress in terms of some of our response around elective waiting times, urgent emergency care performance, we also fully recognise that there is still improvement required and a committed focus to continue that journey of improvement across all of our main areas and our main areas of responsibility. I think the key bit in terms of reflection on 24-25 is the continued strengthening and building of partnerships across the system, because we're really clear that tackling some of these performance areas that have been challenges for a number of years will not be solved by either a single individual or a single organisation. They are multifaceted, they're complex, they're across organisational boundaries, and that requires the relationships, and it requires individuals to take that ownership and leadership to work across the system, to work in a way that supports that drive for continued improvement. On that basis, we will be unremitting and will be relentless in terms of driving for that continued performance and improvement. Equally, need to recognise, whilst we're looking back right at the end of 24-25, in March of 2025, the government's NHS reset announcement that took place that indicated a significant reduction in the running costs of ICBs, which was a precursor in terms of the clustering conversations that we're now progressing with, but removing 50% of the running cost of an ICB is a really significant challenge, and is impacting on colleagues that we work alongside. Important to the AGM for me to recognise and thank colleagues that despite that level of uncertainty and despite that personal impact, individuals and colleagues across the organisation have continued to be resilient and have continued to demonstrate a real focus on delivery. So I want to thank everybody in that space. Equally, really important that I recognise and thank partners. So I touched on the importance of system working in this space. The ICB clearly has a role in terms of its commissioning responsibility and its system convener and its coordination role. But we also fully recognise that healthcare is a contact sport, and that requires clinicians, partners, professionals to be engaging and to be working with local communities, with patients, with residents, and that requires that relationship and that connection across our system. So important that I thank and recognise the work and efforts of all partners across Shropshire, Telford and Wrekin for that work and for that commitment. If we look at progress in 24-25, then whilst recognising some of the challenges, it's important to look at this both in terms of progress that the ICB made in 24-25, as well as some of the progress we made in terms of some of the work that was delivered and some of the changes that were brought about. From an internal ICB perspective, we completed and implemented role management change that delivered the new operating model and restructure the organisation to be fit for purpose. Of course, that was fit for purpose as it was in 24-25 before the latest reset came along. So we will revisit that and we review that now, or we are reviewing that now. With that change and with that reorganisation, we also saw a marked improvement in the staff survey results across the ICB, which was really important in terms of the cultural change and the staff engagement that we were really driving and focusing on. So it's really positive to see completion of the change, completion of the management change, and associated improvements in the staff survey results from an internal ICB perspective. But equally, and we're going to hear about some really important examples of how we're bringing about change shortly. Things like the work we did around Highland Community Hub, and Dr. Harvey sitting with us absolutely led out on that. The work around the care transfer hub, which was between NHS, council, voluntary services, supporting hospital discharge in a really effective way. Partnerships with our local authorities have continued to strengthen. It's a really important relationship with us. So thank both of our local authorities in terms of that work, their work and their commitments. And indeed with education providers. So the relationship between Telford College and Keele University continues to strengthen, continues to grow, and is really positive for young people locally in terms of the aspirations and the impact we can have on individuals' lives. Indeed, I'm at Telford College next week, where we formally open and launch the relationship with Keele University having a visible presence on Telford College's campus, which is a really important step forward, and delighted to have played a part in supporting that to happen. We continue to engage and shape some of the commissioning work in terms of local communities. So we've worked hard around CAMS improvements, cancer care services, and some of the wider long-term condition management piece. We significantly increased the number of blood pressure checks that took place in community pharmacies, up to almost 22,000 checks that took place across community pharmacies, which is fantastic. If then we look forward in terms of 25-26, we cannot get away from the 10-year plan the government's 10-year health plan has been published, fit for the future. We need to make sure now that as part of our reset piece, that we form an ICB and an organisation that is fit for purpose and a vehicle to enable delivery of that through our role as strategic commissioners, and that's what our focus is on, and that's the work that we will look to bring about. We will continue to be absolutely relentless in terms of driving for improvements around elective care waiting times and urgent emergency care measures, easy for me to say, particularly around ambulance response times and the 4-hour target. We will continue to bring a focus on mental health crisis and the outpatient care pathways, and we'll bring a real renewed energy to the neighbourhood health service work. And when I talk about the neighbourhood health service work, that's much broader than just the NHS part of neighbourhoods, where genuinely this is about how do we get into communities and work with communities in a fundamentally different way over 25-26. And we will absolutely require voluntary sector, charity sector, local authority guidance on how does the NHS play its role in the right way there, without assuming that the NHS is always in the best place to say it must be done like this. So we'll balance that energy with some humility in that space. I'm going to hand to Claire shortly, but part of our focus has been about how do we do all of this whilst increasingly gaining grip and control around our financial position. Again, we showed progress in 24-25, but there is still work to do, and we will continue that focus in 25-26 onwards to deliver the medium-term financial plan that this board agreed on behalf of the system to get us back to a position where we live within our means and balance our budgets in that space. And at that point, Chair, I'm happy to hand to my Chief Finance.
There may well be questions come at the end in relation to all over the presentation, but over to you.
Thank you. One of the parts of an AGM is for us to just look back on our financial performance for the year. And so in a similar style to Simon, I will but I'll also do that as well, so we have to go into the future. So first of all, just some headlines really in terms of the extent of our finances. So we received funding for last financial year around about £1.5 billion, and that's for us to look after a population of just over 500,000, as has been already highlighted. And if you break that down, and there's a line in the slide, it's not a lot per person, just under £3,000. So we have to make sure that we are doing our best to get best value for money out of how we spend our money, and we target those scarce resources to the right places. For last financial year, the system as a whole received some deficit support, and the ICB took a share of that. And so our plan for the year, including use of that support, was for us to deliver an outturn of a £4.7 million deficit. In the totality of the system, that was a financial break-even, because we in the ICB were offsetting the bottom line surpluses that were delivered in Robert Jones and Shropshire Community Trust. I'm really pleased to report, though, that we were able as an ICB to go beyond that plan, and we actually delivered a break-even position. So we did 4.7 million better than we initially planned. Along with the accounts, reviews are done through the year by our internal auditors, and our progress in some of that work around control was reflected in our internal audit rating, which improved from the previous year from limited to moderate, which was great news for us and shows that progress that we're making. We also received an unqualified audit opinion from our external auditors, which means that our accounts had a clean bill of health. So if we think about where we spent our money, we've got my usual pie chart that I'd like to bring up for an AGM. And you'll see from here that around about half of our resources currently flow towards hospital services, acute care. And you've got most of that in the segment at the right-hand side of the pie chart, but you'll also see a new entry in here for specialised commissioning, which was a further section of budget that's been delegated to ICBs in the last 12 months. And within that 6% of our pie, there are some acute services in there as well. So as I say, it's around about half of what we commission. Around 10% of our money went to community services, and a further nearly 10% to mental health services. And then across primary care, we've got around 20% of our spend. And that's not just in GP practices and for our prescribing budget, but also for pharmacy, optometry and dental. So you can see where we're investing, particularly into those community services that will be so integral to our work moving forward, and particularly development of the neighbourhood. And for those who saw the medium-term finance plan back in June, you'll know that one of our ambitions around my pie here is to shrink that acute segment and expand some of the community-based segments so that we can really have services around the patients in Shropshire, Telford and Wrekin. As well as money, we've also tried to pull out some facts in terms of what did we get for our money. Now, this isn't everything. There are so many other things, but these were just areas that I think are interesting to our public in terms of how much of things we bought last year. So just pulling out some examples, just over 4,000 births that we paid for last year. That's an average of about 11 a day, so very busy maternity units here and where people are accessing in other counties. We saw just under 180,000 A&E and minor injury unit attendances, and you can see from some of the other supporting stats, ambulance journeys, unplanned stays, and some of our planned and outpatient attendances too. Our GPs prescribed over 10.5 million items through the year. That's a lot of prescriptions. And we had over 3 million GP appointments as well in that time. So significant volumes of activity where patients are accessing our services. So hopefully that gives a sense of what we've got. We'd also got just over 600,000 units of dental activity. So again, lots of people visiting dentists, but that's certainly one of our key areas of focus now and into the future to see how we actually increase that and improve oral health. So finally then, to look forward, we started this financial year with a deficit plan of 2 million, and similar to last year, That's as an offset to a surplus in one of our system partners, because the overall system position is planned break even, and again using some deficit support funding from the centre. As I've put in the slide here, we have a firm focus on delivering our in-year financial plans. I think that message has already come through in terms of Simon's presentation, because actually the finances are a product of the work that we do. So our relentless focus on delivering improvements and delivering our performance targets ties and links very, very closely to the delivery of that finance plan as well. And for those of you that stay for board later, you'll see that so far we've had a really strong start to the year. So we've got some challenges heading into winter, as you would expect, but we've made a really strong start on that. And then finally, just that reference to not just this year, but actually financial recovery overall. We've already mentioned that we signed off a refresh of our finance strategy medium-term plan back in June. We're already working on reviewing some of the assumptions in there. We're doing scenario modelling around demand and capacity. And whilst we're still waiting for some things to come through from the centre, like, what's our ambition for the next few years, what's any guidance around planning, we've made a really strong start to what are our intentions for the next year, 3 years, 5 years, and how do we start to prioritise those. So as we say at the bottom of this slide, our commitment does remain to delivering financial recovery by the end of 27-28, which was the 3-year timeline that we set ourselves in the plan back in June. Also.
Thank you very much. Again, questions that come a bit later on. Thank you for highlighting those all the key outcomes in relation to our financial position, so some of the aspirations moving forward and the way that just to commend colleagues for the focus on delivering the current plan is really, really fundamental to move things forward. We now have 2 very brief presentations. Opportunity to celebrate some good work that's taken place over the last 12 months. I'll ask James if you like to.
Thank you. Yes, my name is James Milner. I'm the Head of Pharmacy Integration Workforce for the ICP. I'm running the legal today. I'm just going to talk to you a little bit about community pharmacy, what we have seen in 24-25, and where we're looking to go for 25 and beyond. So for those of you who don't know, over Shropshire and Wrekin, we have 8 community pharmacies in our patch. All of these have highly skilled and professional workforce made of pharmacy technicians supporting. Based on the hearts of our communities, they're often centred around areas of highest need, and they're all working towards bringing high quality care closer to patients' homes. So, over 24-25, we've seen our community pharmacies deliver more services, more clinical services than ever before. And we can see on screen at the moment, we've got over 75,000 pharmacy first appointments, and that's made up of 21,000 BP checks that we heard about earlier. And when these patients potentially have hypertension, those that go on to a diagnosis and treatment, our modelling shows that this may have actually prevented 3 deaths, 6 strokes, and 4 heart attacks as a direct result of that work. There's also been 2,500 oral contraception consultations, allowing women to access contraception more easily over weekends, in the evenings, without the need to attend a GP appointment. We've also seen over 50,000 community pharmacy clinical pathway consultations for a variety of clinical conditions. And we think this has saved around about 8,000 hours of clinical time in other settings, and we can see that that's quite a significant saving. We've also seen, in addition to this, over 100,000 seasonal vaccines delivered over that winter period for that year. And to note, for COVID-19, that accounts for over 50% of all COVID-19 vaccines that were administered across Telford and Wrekin. This is helping people stay healthier and out of hospital for longer, especially over that winter period. We've also seen over 2,000 DMS consultations delivered. This aims at preventing readmissions back into hospital following discharge as well. So we think that that's saved around about 200 readmissions there. Trusts. So all of this is in addition to the many millions of items community pharmacies are dispensing on a yearly basis, and countless other pharmacy services that are on. So kind of that's what we delivered in 24-25, and we're not really going to stop there. So next year is a really exciting year ahead for community pharmacy as we begin to realise the ambitions of the 10-year health plan. And this is all going to be underpinned by continued development of the sector, a real focus on workforce development, making sure that these highly skilled teams are being upskilled even further to be able to deliver at the top of their licenses. We're going to work on deeper integration with neighbourhood health teams, making sure we're ready for that future neighbourhood health service. And clinical service expansion, focusing around prescribing services, support for long-term conditions, a real strong focus on prevention, wider vaccine support, and enhanced screening services. So I could talk to you about community pharmacy all day, but I know we're really limited on time here. So I'd just like to kind of end and say that I'm immensely proud of how our community pharmacies have all supported all the residents of Shropshire, Telford and Wrekin over the previous year. And I'm really excited to see what they can deliver in the years ahead.
Thank you very much, James. Again, there may be some questions for you later, so we'll stay to the end of the AGM. But thank you very much for a very insightful overview. Just the amount of activity that's good. So we recognise also making sure we are seeing there are further opportunities that's now moving on to a conversation about frailty strategy and the communication engagement lead.
Hi, I'm Harriet Hopkins. I'm Communication Engagement Lead at NHS Shropshire and Wrekin. I'm really delighted to be here today to present to you the engagement work that we did with regards to the frailty and strategy for Shropshire, Telford and Wrekin. It's a really proud piece of work that we've done. So the aim of the engagement was clear that we need to engage with a large proportion of our population in terms of the public, our service users, professionals, and also the voluntary sector, and that would help to kind of shape the strategy and that the vital strategy that we produced, that it aims to basically slow the progression of frailty. So we kind of had a multi-component approach with this. We had different surveys, a public survey, a professional survey. We also had targeted engagement, so we went to those kind of services where there's a high footfall of people who are frail. So that was the care transfer hub, as well as the rehab and rehabilitation wards. And we spoke to people and staff on those wards to kind of see what was important to them and how we could improve our services. We also did a targeted community outreach. We've got a really large database which is still growing of our contacts that are connected with either voluntary community or etc. organisations such as NGK, Energise, Fitball, also kind of assisted living were key people that we engaged with, making sure that we're hearing the voices of people who are really vulnerable and digitally excluded, but also getting to those groups that are ethnic minority groups. And I'm really proud to say that we reached almost 1,000 people during our engagement period. And we only had 6 weeks to kind of deliver this period of engagement, so it really did happen at pace. And that we've had really positive kind of feedback that's really going to help shape the strategy moving forward. We had some kind of key outputs that came from our findings, which included basically there was overwhelming response from our respondents that 95.5% of people said that it's really important that people living with frailty are involved in the decisions about that. We found that 69% of people told us that they see frailty as something that can be prevented. So we shows real belief that if we catch things early, we can really help prevent people falling. and 93% of respondents felt that the support from local health and care organisations made a really positive difference. And that's a really powerful endorsement of the work that we're already doing. We just need to build on that work. But of course, there are lots of things we can improve as well. Accessibility. 6% of respondents felt that current services for older or frail people are fair and accessible. So something that we really can improve on. So it really pulled out lots of kind of interesting things that we can build into our strategy. So really important for us. So this engagement, which we did at pace, is both gives us kind of both encouragement and a challenge. And we can really celebrate the fact that it will have a positive effect and gives kind of a strong foundation to the strategy that is being produced. So that's what I wanted to say. So thanks very much.
Thank you very much again. I know there's some questions. Great, thank you very much. So that's just two examples where there's been progress made over the course of the last 12 months. Also, further work is continuing. We do now have the opportunity for questions from members of the public. I believe for anyone who's online, there is a QR code they can click on. Is that right, Martin?
Yes.
And also they can put any question in the chat as well. But also there's members of the public in the room. Has anyone got any questions? I've got to members of the public in the room first. But any questions? Yes, thank you.
I don't know if anyone was on the GGI webinar this morning, but one of the key themes that came through was, given the turbulence that's existing in the public sector, particularly structural turbulence, and I bless our friend Alan Milburn for once again throwing things up in the air and wondering what will happen when they come down. But the message that was coming through strongly was that, given the negativity around, it's important that we celebrate successes. So which is the most important success the ICS would have over the last year that we wish to celebrate in terms of the population benefit?
Good question. Simon?
It's a bit like asking you to choose your favourite child. There's great stuff that's happening across the whole SCW, different partners, some together, some from one partner. And there is lots that's happened. And I think, when we had full of this introduced event and we talked about so much, and we overran by so much time, we had so much talk. And so I think, my answer to you would be that there are lots of good things. I think I guess how would you want it to be judged? Would you want it to be judged by the impact on the number of patients or the
population health? Fine.
So on population health, but then again, so I can take, for example, Centre for Dementia MDT, which has massively changed how dementia care is approached, those patients in a really sort of collaborative approach with providing a huge holistic aspect and minimal medicalistic need for it. That's had a huge impact on those patients. How many patients have there been? Relatively small, but it was your relative who's having massive challenges and needs, and all of a sudden everything got sorted. That had a huge impact on you. So for that population, it's been great. For the whole county, well, that's helped those with dementia. So if you're 12 and at school got mental health, but that hasn't helped them, but it's helped that population. So you could grind things down into each different population. And there's so much that's happening. You can look at the Highly Hub that Simon spoke about before. That's massively helped that population across the whole breadth of people. That's helped in Highly. What it has done is also created a blueprint to show that you can do that sort of work and create that sort of thing elsewhere. So it will benefit everyone. But there's lots of good stuff that's happening. But I guess to try and pick one would be really hard.
It's the public communication of the success, if I'm looking for.
Yeah, and I think you're right. I think it's very easy to criticise the healthcare system, and it's very easy to say, throw managers especially, but it's incredibly unfair. There is a huge amount that's going on that's right and good, but good news doesn't sell as well as bad news, unfortunately. But I think we've certainly done we've been doing some videos yesterday and today to promote. So there's definitely measures being put in place. Sorry.
Thanks, Laura.
I think in terms of boundary book, I think and patient outcomes, population outcomes, I think we'd be remiss if we didn't give a shout out to statistics. I don't know if you noticed the number of appointments on that slide, but in STW alone last year there were 3.1 million appointments in general practice. General practice is a much maligned specialty. We all know that access is difficult, and that the public are frustrated with it because they value the service so highly. But when you reflect on that 3.1 million appointments, that's about 60,000 appointments per week, which is about 10% of our population being seen every single week. When the contract that the GPs are delivering against was designed, it was for an average of 2 contacts per patient per year. That number delivers a minimum of 6 contacts per patient per year, and attached to every one of those is a highly valued, highly skilled consultation with someone who you can access. Over 50% of people are seen the same day or the next day in STW, and over 80% are seen within 2 weeks, accounting for people's preference, holidays, being asked to leave it 2 weeks before they come back and check in with us. Alongside that, we've seen an improvement in the patient-related measures around patient experience of general practice and the ease through which they can access it, through telephone, the digital telephony that allows you to now receive a call back instead of hanging on and being 27 in the queue, online access, being able to access all sorts of different frontline professionals, mental health, musculoskeletal, all kinds of different professionals. So when we're reflecting on those 6 consultations per patient per year that practices are delivering with an improvement for every patient every single time, I think it just reflects a bit, we just need to reflect a bit of recognition.
So your question has sparked a lot of interest. Last time it's coming in, I know. Let's go to people online.
So I would have gone to Jess and Lorna to answer the question. So I think it's a really important question on a couple of fronts, and I'm not going to look to build on what Jess and Lorna have said in terms of examples. I think your point is one of at a time when public confidence in the NHS is really challenged, the importance of rebuilding that confidence, talking about the things where we're making a positive difference and showing that, and starting to change the narrative around Shropshire, Telford and Wrekin is a really important one that we need to do collectively. I recognise in doing that, though, it has to be based on something that's tangible. So it can't just be, let's push the stories out and hope that then people change their perception and views of what health and care is like in Shropshire, Telford and Wrekin. However, there was a point, and it's not the situation now, where Shropshire, Telford and Wrekin was viewed by other parts of the country as always being at the bottom in league tables. It's not there now in all of the league tables, and we're starting to make that positive progress. And what we need to ensure we do across the board is remain focused on delivering really high quality care, because the most cost effective healthcare is high quality healthcare. So a focus on quality, a focus on the targets across the board, and continue then to build that confidence and build that narrative across all of the things that Jess has talked about, that James has talked about, Lorna's talked about, Harriet's talked about, that we're here in the board meeting. There is amazing care delivered day in, day out across Shropshire, Telford and Wrekin, and we need to recognise that, whilst knowing we've absolutely got things we continue to improve.
That's really important, isn't it, to retain the focus on what still needs to be done collectively. And that's why working together with the partners in the system means that that's going to be in a position to better and more quickly achieve. I don't think there's a question online, so there may be an opportunity for one other question. There is any? Yes.
First of all, I'd like to say I went to the AGM of the Shropcom last week. Absolutely fantastic, the amount of good work that's going on. And the big problem is that it's what I would call the silent service. In other words, the message doesn't really get out about exactly what is going on in the community. Huge amount. And that's a failing of public relations, I'm afraid. You need to up the public relations effort far more than what you do now. Question, what percentage of the acute pie will shrink this year?
So when you say, thanks David. So when you say we'll shrink this year, you mean in comparison to last year?
This financial year, how much will it shrink compared to last year?
Let me pick that up and come back to you on that one, because if I give you a percentage, it'll be wrong. I can return that to you.
Second question, just one more, right? The year before you had 45 million deficit support, in other words, overdraft for ordinary people like me, right? This year it's 83 million. Who negotiated that increase in overdraft? And that negotiation presumably means that you're going to balance your books all the way through this year.
So I'm not sure I'd describe it as a negotiation, David. We had to work very hard to draft a plan to reduce that overall position as far as we could. We then had conversations with the regional and national NHS England teams about that number, and that was agreed to be acceptable. So at that point, the deficit support was allocated to take us from that position to break even. So yeah, we talk about a break-even plan for this year. That's with the help of the deficit support. But as I say, at the moment, we're meeting our target.
And I think there's a consistent message that's come from the board and from provider trust boards that we have a plan and we need to deliver the plan. Nigel, very quickly.
It was only for us to ask it. Only, and forgive me today, you will know it far, far better than me. But I think it's the other way around, David, isn't it? Because our requirement for deficit support continued to reduce, hasn't it, year on year, rather than increase?
And the deficit support overall for the system, yes, has reduced because our total deficit has reduced over time.
Yeah.
That's what we continue to work on. The 45 was the ICB only element of it. So it was 89.9 million for the system in the previous year and then 83.
Thank you very much on that. So we are now out of time. Thank you very much, everybody, for willingness to engage in our general meeting. And thanks to members of the public for attending. Do have a meeting with the public starting at 2 o'clock. People are welcome to attend. That ends the AGM. Thank you very much. Next AGM will be sometime in September 2026. The precise date will be notified. Thank you very much.